just because I looked at them, reviewed them, and made note of them. For a 205, high risk is a little harder to meet in the primary care setting. If you have someone who's really ill, like I said, with like the ulcerative colitis and they're in the middle of a flare, that would be high risk. Acute or chronic illnesses that pose a threat to life or bodily function, you need lots of diagnosis points. So go over your audit tool to make sure that you understand, if you're going to do 205s, you understand what they mean by high complexity. We do have that, and I do have certain patients who meet those criteria. Here's the cheat sheet for those elements for the new patient requirements. I'll let you look at that piece because I'd much rather get to some chart notes. So for this individual, Miss Susie comes in, new patient, here today to get help with her ulcerative colitis and improve her energy. She thinks that they're related, but no one wants to address her fatigue. She would hopefully like to get off her medication someday. She's diagnosed with UC for 20 years. I bolded the pertinent points so we can dive through this pretty quickly. So we have context and status and timing. When she had a severe case of bloody diarrhea that lasted for a month, she was hospitalized, put on steroids, other medications, has been on Asacol and azathioprine ever since. Colitis doesn't feel fully controlled, so there's kind of a complexity point for us. Frequently gets gas, bloating, discomfort, loose stools, no watery or bloody BMs, but they're 2 to 4 times a day. So we have more. We have plenty of HPI going on here. We have a rating of 3 to 10 on the pain. Again, more context and severity. She's taking a few supplements. And then here's about her fatigue. Worse over time, told her PCP, but all he tested was thyroid and it was normal. Energy points. So we have plenty. I'm not going to read this whole thing, but you get the point. We've got lots of stuff on HPI. And we also have things on neuro lightheaded when it gets really bad. She feels some level of dizziness most days, but no loss of consciousness. No weight changes. ENT, cardiology, respiratory are all unremarkable. Appetite varies. Dry, itchy skin. Feels cold frequently. It's pretty clear also with our review of systems, without checking everything off on the audit tool, we have between 2 to 9, and actually probably more than 9. We probably have the whole shebang. She's a non-smoker, no caffeine or alcohol. She does smoke marijuana weekly. We have her diet history. We have family history of IBD in her mother. There's no other significant family history. So we've covered our bases on past family and social history. We've hit all of our points. PE, vitals, eyes, EENT, cardiovascular, respiratory, GI, skin, neurologic, and psych. So I have 9 systems. So this is, it doesn't have to be a lot, but we did all the basics. So we have our 9+ systems, 2 bullet points each. So we end up with that 204 on our physical exam. Assessment, ulcerative colitis, but it's worsened, it's not stable. Fatigue, unknown. Etiology, we need to work that up. It may be part of the ulcerative colitis, but we don't know that. The plan, we order lab work. That's a point. She's overdue for a colonoscopy, so now I've ordered that, and I've sent her off to gastro, so that's ordering out of the medicine section, so that's another point. In the future, we may do stool cultures, but we'll hold off for now. Requesting labs from her previous PCP, so there's requesting records, another point. We'll not make any changes to meds or supplements today. Well, that's another point because now we're managing medications, or that moves us to the moderate risk. And we'll consider further GI support, adrenal support, etc. after we get labs back. She's going to look at SCD diet for me, etc. So if